Part 1. The Physical World of Depression. Chapter 1. What is depression? Quote, "Here is the tragedy. When you are the victim of depression, not only do you feel utterly helpless and abandoned by the world, you also know that very few people can understand or even begin to believe that life can be this painful. There is nothing I can think of that is quite as isolating as this." End quote. Gilles Andrea. People desperately want relief from depression. People want to feel better now. Depression affects us all directly or indirectly. According to the Journal of the American Medical Association, overall, 16.7% of 242 million U.S. adults reported filling one or more prescriptions for psychiatric drugs in 2013. Of the 16.7%, 12% reported taking antidepressants. Therefore, almost 25 million people currently take antidepressants. More than 8 out of every 10 of those take them long-term, 84.3% having filled at least 3 prescriptions in 2013 alone. These numbers don't seem to be decreasing. Additionally, 7% of all visits to a primary care doctor end with a prescription to an antidepressant drug. Depression is estimated to cost the USA about $210 billion a year in lost productivity and healthcare needs. Global revenue for antidepressants is anticipated to grow to nearly $17 billion by 2020. Depression has become a very serious problem affecting many people, and these are only the documented cases of those taking an antidepressant. Many millions more have never been diagnosed, but may also be suffering from the effects of depression. Chances are, perhaps without being aware, you know someone who is depressed. In the hopes that a pill can help to deal with the suffering one carries around on the inside, most desperately look to modern medicine for some coveted relief. What doctors and pharmaceutical companies have led us to believe is that depression is a, quote, chemical imbalance, end quote. We have been told this imbalance requires a drug to manage and manipulate these special chemicals in your brain so that you feel better. The only problem here is that this model isn't working, and a pill is not fixing how depressed people continue to feel. If depression wasn't enough, many other symptoms coexist with depression, which are commonly found in many of the people that come in for help with depression. When people who are depressed come into my clinic, they normally have some combination of these other symptoms as well: fatigue, insomnia, anxiety, difficulty making decisions, dry mouth and skin, getting easily angered, poor memory, headaches, dizziness, weight gain, constipation, loose stools, acid reflux, and heartburn. I see variations of these symptoms in almost 9 out of every 10 people in the clinic. In many cases, we are not dealing with someone just feeling depressed as their only symptom, but with a whole combination of many of the above symptoms. Upon seeing these symptoms in the clinic, the most common drugs that are prescribed for people with such symptoms are antidepressant and thyroid medications. Yet often it is seen that in spite of taking these drugs, they still don't feel well. This is why they find themselves going outside of Western medicine for answers. Over time, people are realizing that taking these drugs hasn't delivered in truly making them feel better. In fact, over long periods of time, many people report that the symptoms get worse, and it takes higher doses of the same drugs to help people maintain. People are starting to wake up to the fact that many doctors mainly just use one tool for what ails people: drugs. If those drugs don't work, some try other drugs. But ultimately, patients seen in the clinic frequently comment on the severe limitations, short-sightedness, and dangers inherent in taking these drugs. People begin to think out of the box, saying to themselves, quote, "There must be a better way than taking drugs to heal my body," end quote. Furthermore, secondary side effects accompanying the taking of these drugs and oftentimes creates even bigger problems. Symptoms are traded for other symptoms. Then more drugs are prescribed to deal with those side effects. It's a vicious cycle, and a better way exists. Has this been your experience so far? If so, you are not alone. Many people bring a, quote, "a drug to heal everything," end quote, mentality to their medical doctor in search of relief. They hope and believe that a pill is going to help relieve them of the many complicated and difficult to deal with symptoms being experienced in the body and mind. As many people are learning, taking a pill for depression isn't working well. People show up in my clinic every week waking up to the fact that something else must be possible to help them feel better. Taking a drug for symptoms most of the time does not address the root cause of the problem, and it only serves to hide it. With more and more people waking up to the fact that these drugs aren't correcting the root problem of their depression, Many questions begin to arise, such as, how can I actually feel better without taking a drug for the rest of my life? Are there better natural health solutions to depression and anxiety? Does science support a natural healing way, even though medical doctors may not be aware of it? Are the current medical solutions, drugs, for my good, or are they meant to keep me as a paying customer for the rest of my life? What if the root problem to depression isn't entirely physical? What did or does the ancient Chinese system of medicine say about the root cause of this problem, and is it still valid today? Will Chinese medicine and acupuncture help me to feel better? How can I release these horrible feelings and emotions that I carry around every day? These are the questions I started to entertain that led me on a long and very arduous road to healing from depression, both physically and emotionally. While depression medication has been life-saving for many, and in many cases it may be necessary for a short season, ultimately it is not the answer. Depression, like all other health problems, must be looked at and treated holistically. We need to see the whole picture, including any and all of the factors that may contribute to how you are feeling. This book addresses all of these questions. You can heal without taking a drug for years or the rest of your life. Natural solutions exist that have been proven to work. Depression is a multifaceted issue that is experienced differently in different people. Chinese medicine has successfully treated this issue well for thousands of years and can continue if we turn back to the wisdom it holds for human health. Beyond the physical body, emotional trauma must be adequately addressed as well. The first part of this book covers the physical aspects of depression. The latter half of the book covers the emotional side of depression. Both are equally valid, though one might gravitate towards one aspect over another. Regardless of the root cause of depression, at the heart of it is the overall desire to want to feel better. Our unhealthy symptoms don't feel good. Behind wanting to change, stop hurting, and to heal is a desire to simply feel better. We all want to be able to feel alive, have purpose, and be relatively free from physical symptoms, negative emotions, and the suffering that can dominate our lives. What better way to start improving health than to take a very introspective look at what might be sitting behind your health conditions? We need to ask what physical and environmental factors, traumas, and emotions have contributed to or caused us not to feel good. How good would we feel if we cleaned up the toxicity in our lives both environmentally and emotionally? How good would we feel if we learned to let our negative emotions go? The path to healing from depression is different for everyone, but my hope is that this book covers many of the factors which may be contributing to the depression you have or those you love have. It cannot be understated how powerful the mind is and how letting go of negative emotions can be very physically healing. While I feel the mind is the most misunderstood and neglected part of healing in the world today, physical things also do play a very big role in helping us to heal. Before we discuss the powerful role emotions have in our healing, we will first talk about depression and how it is understood from a Western perspective and the issues that we are facing from within this paradigm. Let's take a look at how depression is defined, what Western medicine recognizes as the causes, and the common interventions used today. After that, we will discuss how effective this model has been and what the true causes of depression are in the world today. Defining depression. People often come into the clinic and describe feeling depressed. What does this mean, though? When you ask people specifically how they define feeling depressed, the answers are wide and varied, but do contain similar themes. Here are some of the ways that it has been described by people. Depression is like a dark black hole that is cold, lonely, and seemingly inescapable. It is isolating, like being on a deserted, cold island all alone. It pushes everyone that is in your life away because they don't seem to understand. It is not wanting to wake up every morning because the only thing you feel is the crushing weight of hopelessness that awaits you each day. Depression is a cloud of not being able to see anything ever changing or being able to see any other possibilities other than the limiting ones that you experience every day. Depression feels like a needle that is directly injected into your soul, sucking all the life out of you, mustering all the energy you have just to do the simplest things throughout the day. It has pushed away many of my loved ones and friends because of how intense the suffering is inside. I just want to sleep all day long and never wake up. Sleeping seems to be the only thing I enjoy because I get to shut off every day. And lastly, I just want the pain to go away. I don't want to live anymore. Persistent depressive disorder is defined as having 5 of any of the following symptoms on a nearly daily basis for at least 2 years. Persistent, sad, anxious, or empty mood, feelings of hopelessness or pessimism, feelings of guilt, worthlessness, or helplessness, feelings of a loss of interest or pleasure in hobbies or activities, decreased energy, fatigue, or being slowed down, difficulty concentrating, remembering, or making decisions, difficulty sleeping, early morning awakening or oversleeping, appetite and or weight changes, thoughts of death or suicide attempts, restlessness or irritability, aches or pains, headaches, cramps, or digestive problems without a clear physical cause and or that do not ease even with treatment. What does Western medicine recognize as the cause of depression? According to WebMD, quote, depression is an extremely complex disease. No one knows exactly what causes it, but it can occur for a variety of reasons. Listed as contributing factors are abuse, certain medications, conflict, death or loss, genetics, major events, serious illness, and substance abuse. Most of these factors can be attributed to having emotional bases, such as abuse, death or loss, major events, and conflict. The Mayo Clinic also mentions, quote, it's not known exactly what causes depression, end quote, but lists more physical reasons such as biological differences, brain chemistry, hormones, and inherited traits. According to the National Institute of Mental Health, quote, research suggests that a combination of genetic, biological, environmental, and psychological factors play a role in depression, end quote. This last definition is probably the best broad definition found so far, encompassing all of the contributing factors that play a role in this health condition. Depression is a mixture of both biological or physical, environmental, and emotional factors. While these are very broad sweeping categories, more precise factors in each of these categories are involved in the formation of depression. These sites fail to mention the precise primary factors that are responsible for depression, which we will be discussing very shortly. What are current Western medical interventions for depression? Drugs are by far the most used substances to treat depression in the United States today. Below are some of the most common drugs that have been used to treat depression since the 1950s. Selective serotonin reuptake inhibitors, also known as SSRIs, were launched in the mid to late 80s, including well-known drugs such as Paxil, Zoloft, Celexa, and Lexapro. They essentially flood the brain with serotonin in an effort to make you feel better. I took these personally for months, but never saw any noticeable effects, and they made me feel funny or off, which many have also reported. Serotonin and norepinephrine reuptake inhibitors, or SNRIs, are a newer type of antidepressant. In addition to flooding the brain with serotonin, these drugs also flood the brain with norepinephrine. This neurotransmitter is involved in the flight or fight response and mobilizes the body for arousal, alertness, and vigilance. Tricyclic antidepressants, also known as TCAs, was some of the first medications used to treat depression and work in a very similar fashion to SNRIs. Monoamine oxidase inhibitors were also among some of the earliest drugs used for depression. These drugs have high interactions with other drugs and can cause serious side effects. Other mood-stabilizing drugs exist, such as antipsychotics, lithium, stimulants such as Ritalin and others, and anti-anxiety medication that also have been used to treat depression depending upon various factors for certain people. Psychotherapy or talk therapy for the treatment of depression. Psychotherapy, next to drugs, is another intervention that is highly suggested for those suffering from anxiety and depression. Many people feel so isolated and alone that simply talking with another person on a deep level in a safe and trusting environment can be very helpful. In general, I love psychotherapy and think it is something everyone should go through. Some people have such deep states of depression that directly addressing the emotions that are causing their problems can feel threatening, especially if they have a mountain of trauma that needs attention. Therefore, a strong therapeutic relationship may need to be built very slowly over time to foster trust and confidence with the practitioner before helping someone to completely let go of their emotions. Another approach is to focus on physical healing first as a foundation. Then, in the future, once people physically feel better, they may feel ready to tackle emotional issues. Ultimately, though, learning how to surrender and let go of negative emotions, in my estimation, is the most direct path that can help people to heal the fastest. In the book, Letting Go of Depression, In the book Letting Go, The Pathway of Surrender, psychiatrist Dr. David Hawkins, MD, who ran one of the largest psychiatric practices in the world for more than 30 years, noted this about the surrender of negative emotions. Therefore, as a person constantly surrenders, physical and psychosomatic disorders improve and frequently disappear altogether. There is a general reversal of pathological processes in the body and a return to optimal function. So many people on this planet feel isolated and keep many of their feelings bottled up inside. Psychotherapy is wonderful to help people express and talk about the things they have buried for years. Simply voicing feelings can be very therapeutic and is a much-needed form of initial release. In addition to this, I have observed profound changes in people when they surrendered their emotions, the emotions that have imprisoned them for so long. So many incredible psychotherapists are actually moving in the direction of total surrender and emotional release. Movements in this direction have often been spurred on by focusing on greater understandings in mindfulness and non-duality. Mindfulness is, quote, the practice of maintaining a non-judgmental state of heightened or complete awareness of one's thoughts, emotions, or experiences on a moment-to-moment basis, end quote. Mindfulness helps to bring the unconscious conscious. Mindfulness is an amazing way to bring awareness to one's deep and rich inner life. Having an awareness of one's emotions is the first step towards freedom. The second step is total freedom through the complete surrender of those emotions. The surrender of emotions was my pathway to healing. Everything changed once I learned how to release emotions. That whole process is outlined here and is why this book was written. If you have found psychotherapy useful for you, I highly urge you to continue it. How effective are pharmaceutical drugs for treating depression? Depression is not a chemical imbalance in the brain. It can be dangerous when we start tinkering around with select chemicals in the body and brain, especially when not one study exists to support the idea that depression is a chemical imbalance that will be fixed with medication. The drugs for depression are not only failing to produce lasting relief, they are making people even sicker while deepening their sense of hopelessness. One of the known side effects of antidepressant drugs such as Prozac is an increased risk of suicide. Other side effects of antidepressant drugs are loss of appetite, dry mouth, rash, and abnormal dreams. Another phenomena of side effects is called, quote, serotonin syndrome, end quote, including symptoms such as high body temperature, agitation, increased reflexes, tremor, sweating, dilated pupils, diarrhea, seizures, and muscle breakdown. In 2007, the FDA required all antidepressants to carry a black box warning stating an increased risk of suicide for those younger than age 25. It is not uncommon for people who are severely depressed to express a desire to commit suicide, yet we give them a drug that may potentiate this symptom. Is this responsible medicine? Is it worth it to try to fix depression only to expose oneself to the many side effects that people experience by taking this medication? Is this the best we have today in our technologically advanced world? Evidence-based, drug-free treatment for depression exists and works very well, yet is not on the forefront of medicine due to pharmacological influence. One of the most astounding things that psychiatrist Dr. Kelly Brogan states is, quote, antidepressants have repeatedly been shown in long-term scientific studies to worsen the course of mental illness, end quote. She goes on noting, quote, the dirtiest little secret of all is the fact that antidepressants are among the most difficult drugs to taper from, more so than alcohol and opiates, end quote. We are hearing so much in the news about the opiate crisis, but what about the profound changes that occur detrimentally in the brain as a result of taking antidepressant medications for years? The damage and dependence on these drugs in our world is extensive, but with the right healing protocol, the damage can be reversed. Pharmaceutical brainwashing. We have been brainwashed by the pharmaceutical companies that a cure or a fix to all health conditions will be found in a pill. A pill or drug will never be able to heal most chronic health conditions. Yet, as a society, we continue to buy into the brainwashing that a magic bullet pill will cure our diseases. For example, we are encouraged to, quote, run for the cure, end quote, to raise money to develop drugs that supposedly one day will be the cure for cancer. Believing in drugs to save us is psychological manipulation of people's biggest hopes and fears. If we acknowledge the rather obvious causes of cancer, such as environmental and food toxicants, we would know that a drug will never be able to do what's necessary to deal with those causes. We are encouraged to take the, quote, ice bucket challenge, end quote, dunking ourselves in water to raise awareness for ALS or Lou Gehrig's disease, all the while donating money to pharmaceutical companies to create a magical, mythical pill that will one day cure people of this and other health conditions. I'm all for awareness, but I don't buy into the model that cancer, ALS, or other chronic incurable conditions will be cured with a pill. This is especially the case when the etiology or origin of many such diseases is still unknown by Western medicine. It is just simple brainwashing. Drugs will never be able to solve the majority of health issues that ail society today. As we continue to go against the flow of nature with the health of our bodies, the consequences will become even more devastating. Occurrences of the worst diseases continue to escalate, and the only seeming solution from Western medicine is more drugs. We still use horrible toxins like radiation and chemotherapy to deal with cancer. The irony is that toxins are one of the primary causes of cancer. We are using toxins to deal with toxicity in the body. It is sad that the best we have in 60 years of cancer research is just more sophisticated forms of radiation and chemotherapy. Radiation and chemotherapy destroy an already weakened immune system. Instead of destroying the immune system, medicine should be focusing all of its efforts on discovering what weakens the immune system and how we can make it stronger so that it can deal with cancerous cells on its own. Cancer and many other chronic health conditions are preventable if we implement healthy, life-giving habits early in life that correspond with nature and what Chinese medicine has said for millennia. Chinese medicine is a system of medicine that was developed by watching and following the healing rhythm of nature and uses a deeper understanding of the nature of the human body to create health with minimal to no side effects. Chinese medicine has worked beautifully for thousands of years, and now more than ever, we need its wisdom to deal with the catastrophic health problems we see in the world today. When we work in harmony with nature, health tends to abound. The biggest problem with thinking that a pill will be what cures us from depression or any other health problem is that it largely negates personal responsibility for one's lifestyle choices and surrounding environment. I see this every day in the clinic with my patients and have also wrestled personally with this mentality many times over the years. It is as if we think we can do whatever we want, live ignorantly of the natural rhythm of our body, and live within a toxic physical and emotional environment only to think that taking a pill one day will fix the years of damage we have allowed our bodies to endure because of the poor health choices we have made. This mentality spills over into the natural health world as well, with people chasing the next super supplement that will fix all that ails us. Supplements can be very useful in healing, but are meant to supplement a healthy lifestyle, not be the sole solution to everything. If we truly believe as a society that a pill will one day be the magic bullet for every health problem, we will continue to perpetuate a mentality that the pharmaceutical companies will save us. Let me prophesy about the future and tell you that this will never work. Believing in a magic pill is not taking responsibility for our bodies or environment. Disease and health problems have been skyrocketing for many decades. During this time, the drug companies have created drugs for every conceivable symptom and disease, but as a society, we are not any healthier. We need to start asking difficult questions about why disease is skyrocketing and what the true causes are for the majority of our health problems. When people show up in my office, they are, to some degree or another, ready to take responsibility for the many factors that may be contributing to their not feeling well. We have to start taking a closer look at the many foods we consume and things we are exposed to that contribute to people feeling depressed. When we take a closer look, not only does current scientific research expose the true offenders, but the solutions are stunningly simple. Depression drugs versus placebo. It has been documented that depression medication in many cases does not perform better than a placebo. A placebo is a substance such as sugar in pill form, which is used in drug trials and is given to people to contrast how it fares in efficacy against the drug. The placebo effect shows how powerful consciousness and the simple power of belief are in a pill. We literally create healing with our intention, emotions, and thoughts. Imagine if we believed we were going to heal combined with things from nature that actually contributed to health and caused no side effects. The drug companies are not interested in things such as using healthy food and herbs, which have been used to help people heal from depression for thousands of years. You cannot patent and make billions from food and herbs. Therefore, the same research, time, and money are not spent on such things. Let's be perfectly clear that the drug companies are not interested in symptom-free health. Symptom-free health would mean they would go out of business. They are primarily interested in making money. They are not interested in finding cures. They are interested in you needing a drug for decades or years, constantly refilling prescriptions, getting vaccines every year, and making a killing in profits. They will go to great lengths to provide education to doctors and generate commercials promoting things that are dangerous in the long run only to make money. In many cases, the means do not justify the end, especially when tried and true options exist that are safe, healthy, have been studied, have virtually no side effects, and are relatively inexpensive. This is the heart and wisdom of Chinese medicine. Tried and true foods, herbs, and formulas have been used for millennia that work in harmony with the body to restore balance and health in the body. Why are we not dumping tons of money into studying and promoting this more? It is simply because herbs cannot be patented or owned and don't generate billions of dollars. They don't generate the billions of dollars that drugs do. Moreover, insurance companies don't cover the cost of herbs. They only cover drugs, and this is our modern reality. Addiction and withdrawal from antidepressant drugs. One study concluded that withdrawal symptoms from SSRIs were comparable to trying to quit sedatives and barbiturates. Many of my patients report feeling horrible after deciding on their own to stop their antidepressant medication. Unless the true causes of the problems are addressed, they continue to feel awful. Many times they also report returning to their primary care doctor with the complaint that the medicine isn't working anymore and that they need something in order to feel better. It is not surprising that coming off of depression medication is potentially the same as withdrawing from sedatives, barbiturates, and other illicit drugs. You cannot alter chemicals in the brain for long periods of time without damaging and addicting consequences. Yet in spite of the damaging effects, the human body has a remarkable ability to heal within a short period of time with the right interventions. When the true causes of depression are addressed, patients will often report feeling better within weeks. Dr. Roger Williams summarized it best when he stated, quote, "The basic fault of these weapons or drugs is that they have no known connection with the disease process itself. Drugs are wholly unlike nature's weapons. They tend to mask the difficulty, not eliminate it. They contaminate the internal environment with side effects, create dependence on the part of the patient, and often complicate the physician's job by erasing valuable clues as to the real source of the trouble." End quote. Quote, the part can never be well unless the whole is well, end quote. Plato. Reductionism versus holism. Western medicine is mostly reductionistic in nature. This philosophy began with René Descartes, a French philosopher that lived in the 17th century. It takes the whole and reduces things down to individual components or parts. In trying to figure out health problems, the body as a whole is reduced to figuring out which chemical or small part is problematic. We see this mentality at work in blaming our genes for our health problems. Two main problems surface from this mentality. First, we are blaming genes for our health problems. This, just like taking drugs and thinking a pill will save us, doesn't allow for taking personal responsibility for the real factors behind our health problems. Second, the ones behind propagating this mentality are oftentimes the drug companies. We have been wrongly taught that our genes are where our problems can be found and corrected. Buying into this mentality is seen in the hysteria of Angelina Jolie undergoing a, quote, preventative, unquote, double mastectomy, cutting off both of her breasts in an attempt to make sure she doesn't develop breast cancer due to a gene mutation. This is on the same level as absurd as medical doctors promoting cigarettes as healthy 60 years ago. However, this solidifies the narrative for the current medical industry, which continues to get us to believe that our genes are defective. Chinese medicine sees the whole picture, body, mind, and spirit, and seeks to identify and correct anything in each of these realms which would be contributing to one's health problem. The environmental and lifestyle influences on our genes are a much greater factor in affecting our genes than the actual genes themselves. Epigenetics is the study of environmental factors that lead to poor gene expression. Epigenetics takes a hard look at all of the factors involved in someone's life that influence gene expression. In Chinese medicine, a large emphasis is placed on what has been or is present in the environment that may be a possible cause of a health problem. Reductionistic medicine treats the body much like a machine. A machine is just made up of a bunch of parts. If one can understand all of the parts down to the very smallest part and learn to influence, change, or fix said parts, we should be able to fix what is wrong, or at least explain why the whole body functions a certain way. If we can figure out which part is not functioning correctly and fix that part, the whole can be understood and should start working again. Western medicine has looked for answers in the smallest parts of the body, including our genes, chemicals, enzymes, and specific cell components. It then creates a drug to influence that small part of the body. Reductionism is like looking at a tree in the forest, whereas holistic medicine keeps the smallest components in mind, but also looks at the entire forest as well. Chinese medicine doesn't invalidate reductionism over holism. Looking at the smallest parts we have has given us incredible access to information and understanding into things that we didn't know 100 years ago. This information has been very helpful and insightful. Reductionism isn't bad and holism good. They are just separate models of understanding disease in the body. We can hold a view that incorporates both into the picture, combining the best components of each view. The problem occurs when medicine is practiced only in a reductionistic way, which largely is the case today. This is evident in taking a drug for every symptom we seem to have. This can be very short-sighted because symptoms start to look all like nails, and the only tool to work with a nail is a hammer or drugs. This is changing in the medical world, but has a long way to go. Epigenetics, the true influence of health issues. Dr. Bruce Lipton, PhD, in his book, The Wisdom of Your Cells, states outright that our genes do not control our health. Instead, he talks about epigenetics, or the environmental influences that turn on and off the expression of our genes. If you place cells or genes in a healthy environment, they continue to be healthy. If you place cells or genes in an environment lacking nutrients, full of toxins, or induced stress, they will begin to express sickness or disease. Genes themselves, affecting less than 5% of the expression of health in our lives, are not the largest contributing factor to sickness that we have been taught to believe. Think of the human body as one large cell. It is critical to take a look at the human body and the tremendous impact all factors in our environment play in determining our health. The environment that humans are in today is far more toxic than ever in our history. When combined with other environmental toxins and stress, what emerges is an understanding that the health we have today is a direct result of the many environmental factors we are exposed to. We must consider all of these influences. When we do, we realize that each one of us must be responsible for the factors we allow to affect our health. It is in taking responsibility for the totality of our environment that we can reclaim our power to do something about it. The reversal and natural healing of cancer, heart disease, diabetes, and depression will arise when we are taught to take full responsibility for our health from birth and live in a preventative environment rather than waiting to take responsibility when we are diseased and toxic after a lifetime of environmental abuse. Let's use an example about epigenetics in reference to heart disease. Heart disease is the number one killer of people in the USA today, accounting for over 610,000 deaths each year. People commonly claim that since heart disease runs in the family, it must be a genetic problem. This is the furthest thing from the truth. If we look more closely, we see that horrible dietary practices, decades of toxic environmental exposure, and the emotional stress inherent in that particular family are the actual factors behind the expression of heart disease. Heart disease is not a genetic problem and can be prevented and reversed in most cases. T. Colin Campbell, PhD, Professor Emeritus of Nutritional Biochemistry at Cornell University, authored a book called The China Study, which analyzed the link between diet or environmental influences and diseases such as cancer, heart disease, and diabetes in China. The conclusion was that environmental influence and certain consumed animal products altered genes in such a way that expressed disease. When these factors were addressed and animal products were removed from the diet, these diseases reduced significantly or reversed. Dr. Caldwell Esselstyn, medical doctor and heart surgeon, wrote a book entitled Prevent and Reverse Heart Disease, which also states that natural solutions exist to this horrible health problem. The environmental factors that contribute to the number one killer in the United States are the same factors that contribute to depression. You will not see this information given to aspiring medical doctors in school, nor will it be advocated for by pharmaceutical companies. The road to healing takes drugs off the table, which is not profitable and would be a threat to the current system of health. Observations from shadowing an internist. In January 2018, I spent time following a medical doctor and internist on his rounds. This experience gave me a wonderful view into the common state of reductionistic Western medicine as it is being practiced today across the United States. It was very eye-opening to see this experience firsthand. Here is what I observed after spending time in this environment. Number 1, the average appointment with the doctor was around 10 to 12 minutes. Number 2, no causes to health problems were discussed at all. Number 3, what I observed was symptom management through more drugs and nothing more. Number 4, no concrete lifestyle or dietary changes were recommended. Number 5, the doctor didn't appear to know concrete causes behind most of the issues presented as it applied to each person. Or, if he did, no plan was put in place to deal with it outside of using drugs. Number 6, patients honestly didn't know about many of the things that contributed to their health problems. Number 7, no incentive is given to patients to change their health either from the healthcare provider or the insurance company. Number 8, a pill was commonly prescribed for every major symptom that was expressed by the patient. Number 9, some patients were on between 5 to 15 different medications. Some of the medications were taken solely to deal with the side effects of other medications. Number 10, when I was given permission to offer advice, most of the people were not interested in hearing more, but simply wanted a pill to make their symptoms go away. The only medicine I observed in this experience was very reductionistic. For every symptom that was named by each patient, a new drug was suggested. In almost every case, this was the only thing that was recommended. The only other thing that was mentioned in cases where it was required was surgery. This was a very enlightening but sad experience for me. The doctor I followed is a wonderful, caring human being and is extremely intelligent. He was just following the model that he learned in school. This model is heavily influenced by the drug companies. Pharmaceutical drugs are largely directed at influencing very small parts of the body in an attempt to effect a change that corrects a symptom. However, in my view, this really is not true medicine. Medicine is supposed to be an attempt at the full natural healing and prevention of disease. Most drugs do not cure or prevent any disease. It is impossible to try to get to the root of someone's health issues only by spending 10 minutes with them. While each patient was in the exam room, the doctor was looking at the computer and typing almost the entire time. This is because of the necessity to have the medical record updated with each visit as required by the insurance companies and for liability purposes, both of which cut into actual patient care. These things are not the fault of the doctor. How can you really be present with someone for only a few minutes? How can you get to the root cause of a health issue in that time? How can you keep people accountable for their life and choices? How can you aspire, educate, and encourage someone to take a healing course of action by just spending a few minutes with them? These visits were mechanistic, short, encouraged the use of more drugs, and never got to the root of the issues. This is healthcare in the USA today. I hear the same experience from patients all day long. I have 50-minute sessions with people during a visit, and oftentimes wish I could spend longer with them. Treating people with drugs is mostly just sick care and managing symptoms. If the majority of people stopped taking their medications, the symptoms would come roaring back, which is the primary indicator that the root cause is not being addressed. This is especially the case in the treatment of depression. The best treatment is not taking medication to stop a symptom. It is dealing with the underlying causes so that drugs don't need to be taken on a long-term basis. Even in cases where, quote, life-saving, end quote, medication is needed, another way to heal almost always exists. This is certainly the case even with diseases such as diabetes. Arguably, the foremost expert in curing people from diabetes is Dr. Gabriel Cousens, MD. His book, There is a Cure from Diabetes, is full of scientific references along with his proven program to help people heal completely from diabetes. A good percentage of type 1 and most type 2 diabetics can be medication-free within 30 days with the right natural intervention. For some type 1 diabetics, it is possible for the body to start producing insulin again if the factors are addressed which are destroying the beta cells in the pancreas. Yet most doctors are unaware of this information, or some may just find it easier to hand out drugs rather than helping people heal naturally or keeping people accountable for their poor choices. This would require physicians to take a stand, educate themselves, and orient their medical practices around a completely different model of health. On a side note, the same medical doctor approached me not long after I spent time with him. He kept hearing over and over again from his patients about how cannabis oil, or CBD, was powerfully helping his patients sleep better, feel less pain, experience less anxiety and depression, having diminished seizures, and feeling overall much better. He couldn't ignore the overwhelming anecdotal advice that many of his patients and his own family were experiencing by using CBD. I have also seen and heard this anecdotally from many of my own patients. CBD is just one product from one plant. In Chinese medicine, hundreds of plants are used that have stood the test of time and work just as well to deal powerfully with any symptom that the body may exhibit. CBD can help, but in my experience, even more foundational things must be addressed for people to truly heal in the long run and not just become dependent upon something else like CBD. Doctors should be doing whatever it takes to find the true causes of the problem and work to correct them through natural or organic means first. I'm not opposed to using life-saving medication or any other medication in the short run, as long as the ultimate goal is to heal through natural means whenever possible, so that drugs don't have to be taken long-term. This is truly doing no harm. In Chinese medicine, I observed that when the right physical, electrical, and emotional causes are identified and addressed, people can heal naturally. At the very least, symptoms decrease and few to no side effects occur. This is how medicine should be. True medicine is not taking a pill for the rest of your life when the possibility exists to correct cause through natural means. I hear people ask me constantly in public, quote, what supplement should I take for blank problem, end quote. True, vibrant health will never be reduced to what one will find in a pill, even if the supplement was the best whole food supplement money can buy. I have people that come into the clinic all the time that take mountains of supplements but still have many symptoms. If the supplement or drug fixes things, the symptoms should go away, but oftentimes they do not. People's hearts and intentions are good in trying to find reliefs for their symptoms, but some have replaced drugs with supplements because the mentality is the same. Our society has been conditioned by the drug companies to believe that a pill should solve all of our health problems, even if that pill is all natural. Recently, I was with a different medical doctor, one who has been practicing in Florida for the past 15 years and gets to the root of her patients' issues through what is called functional medicine. Functional medicine is the modern Western medicine equivalent of naturopathic medicine, and even to a certain degree, Chinese medicine. Functional medicine purports to determine why illness is occurring and to correct the problem at the root physical level through the most natural means possible. To be clear, functional medicine is a significant departure from conventional Western medicine and truly does try to get to the root causes of these issues. Many of my acupuncture colleagues, including myself, have embraced this and incorporated it into their Chinese medical practices. Functional medicine has its limitations, but is far better than conventional medicine at addressing the root cause issues. When functional medicine is combined with the ancient wisdom of Chinese medicine, the possibility for healing is even greater. As I spoke to this very passionate, informed, and well-spoken medical doctor, she said that in her third day out of medical school 15 years ago, she had this stunning realization that she was just going to be a, quote, legalized drug dealer, end quote. These are powerful words coming from a medical doctor, and there is much truth to this statement. She looked out into her future and realized how this was not what she signed up for and wouldn't make the difference she wanted to make in the world of medicine. We see the painful reality of this when it is documented by the CDC in 2016 that 63,632 deaths occurred due to drug overdose, many of them from properly prescribed medications. Moreover, adverse drug reactions cost us $136 billion annually. She has a thriving practice with testimonials from many of her patients that have reclaimed their health and life from the plight of poor health through natural means. Functional medicine works, as does Chinese and naturopathic medicine, and people are utilizing these branches of medicine to heal now more than ever. In summary, the substantial limitations of Western medicine have become clear when looking beyond acute medical care. If you break your arm, no better medicine exists than Western medicine. If you need surgery, Western medicine is the best game in town. However, when it comes to prevention, understanding food and diet to help heal, identify root causes, and using treatments that actually treat root causes to chronic health issues, Western medicine is not the best option on the planet. It is a system awash with programming from drug companies that drugs are the savior we will all continue to need. Drugs don't heal most chronic health conditions. They have extensive and damaging side effects and are meant to be continued for years or decades, ensuring profits and retaining good customers for many years to come. We need to start taking responsibility for our health, one person at a time, and be the change we wish to see in the world and in our healthcare system.